So at this point, you might be wanting to know a little bit more about me and my team at Elevate Health and Wellness. So I'm just going to share my journey and what brought our team together. And hopefully that will make you feel a little bit more comfortable when you get on the phone with us. I am Dr. Sarah Kirsch. I'm a chiropractor. I went to Indiana University. I studied or got an undergraduate degree in nutrition science and then went on to become a chiropractor. So I studied chiropractic at National University of Health Sciences in Chicago. And then I went on to get a master's degree in human nutrition at the University of Bridgeport in Connecticut. I, from that point on, have really been studying and interested in functional medicine, which kind of takes the nutrition training to the next level and pairing it with helping people get to the root cause of what is going on with their health. So, as a chiropractor, you can imagine I see a lot of people that are struggling with chronic pain and chronic muscle tension. And I found that helping them to heal their gut and replenish any nutritional deficiencies has been really instrumental in correcting and helping them overcome their pain. So that's kind of what led me down the path of functional medicine. And I've been blown away by the transformations that I've been able to get with my patients over the years. It's been about 15 years of doing functional medicine. And I think that I found there was so many people that I was able to help, but where I found some people would take my plan and run with it and be good to go, other people struggled to implement it. So I knew that I needed to work with a team. And I found Teresa, who is a health coach, and she has been trained through the Institute of Functional Medicine's nutrition program. And so she's actually very well informed on the pathways and the dietary approaches that functional medicine works to help heal. And so I was really excited to bring her on board. She's been helpful in getting people to implement these sometimes difficult changes. They're not all difficult, but sometimes the changes are difficult to implement into a busy, hectic lifestyle that some people are facing. So whether that's multiple kids, working full time, working multiple jobs, traveling often, there's always some kind of challenge there. And Teresa's really great at helping people, decide out of our plan what is the most important thing to focus on first and how to implement these changes into a busy lifestyle. So, of course, as a chiropractor, there's also some limitations in my scope of practice in the state of Michigan. And sometimes I would find that patients maybe needed some medication, or perhaps they needed some hormone replacement therapy or some vitamin or nutrient injections. And I wanted to broaden what I was able to add the services that I was able to offer my patients. So I decided to partner up with a doctor of osteopathy. Her name is Dr. Jacqueline Israel. She is a great asset to the team. She is our medical director. So not only is she bringing you these additional services, but she is overseeing every patient that comes into our office. We have a team meeting every Monday where we all meet and discuss every new patient that comes through the door. And so that's pretty exciting to, just have her insight from her medical background and what the traditional medicine pathway would be. She's overlooking and making sure that we're not missing anything from that perspective. And then we're also, of course, delivering the alternative side and presenting our patients with both options. And then I also partnered up with Nicole. She is our PA. She has a lot of clinical experience in the field of functional medicine, cardiovascular world as well. And so she's also worked at an urgent clinic before. And so she has a vast array of skills and a wide knowledge base to help patients with a lot of different things, from thyroid health to adrenal health and hormone health. Like, that's really her bread and butter of what she likes to help people with. And so I was really happy because I find that there's so many women, men too, women especially, who are dealing with both chronic pain. They're dealing with gastrointestinal issues like I was. And then they're also having symptoms of hormone imbalance. And we wanted to be able to create a program that will really help walk everybody through um, all of these changes, because change takes time. And while the traditional medical route sometimes offers medications that work quickly, sometimes the functional medicine approach is a little bit slower. But it's nice to know that you have us as a team to help you implement these changes. And once you do, you can get lasting results and not have to be tied to our supplements or our protocols for forever. We're going to help you figure out what is going to be the most important thing for you to do right now. What's the next phase of care for you? And then what do you need to, continue to do to stay well? And that's going to be different for everybody. So we've really worked on tailoring our approach to each person, not just a condition like blanket, everybody gets the same thing. That is not what we do. We are very, very customized in our approach with our patients. So hopefully that helps you understand our background and our training and our knowledge. And then I think that once you meet our team, you'll feel very confident that we can put our heads together and help you. And if we can't, trust me, we will not hold you hostage. We will let you go and try to get you connected to the person that will help you. So we look forward to talking to you on the call. If you have any questions about us as a team, you might want to bring that to your call as well. And we look forward to hearing from you. Talk to you soon.